New cancer guidelines aimed at women, this time about the annual Pap, like the mammogram guidelines released earlier this week. These new guidelines, released overnight, recommend women cut back the number of Pap tests they get. Our medical contributor, Dr. Marie Savard, joins us now with this. And so give us the bottom line on these new guidelines.
Robin, these guidelines were developed by the American College of Obstetricians and Gynecologists, the very doctors that take care of women. And there are three changes. First, they're recommending that women not begin their first Pap test until they're age 21. Previously, it was age 18. Second, women between the ages of 20 and 30 start having a Pap test every other year rather than every year. And women starting at age 30 on have a Pap test every 3 years. On the other hand, that means they need to have had 3 normal Pap tests in a row before they can start that every 3-year sequence. And they also suggest the option of adding an HPV test at the same time to the women 30 and over to add extra assurance.
What strikes you as significant in these new guidelines?
I think there is good news here. I think young women, we know they have often abnormal Pap tests. It's often because of the HPV virus that can cause changes on the Pap test that will go away within 1 to 2 years. And we know the treatment damages the cervix and can lead to increased risk of premature birth in these young women. So we think it's good news to change that to age 21. But I am worried that for older women, getting it every other year, every 3 years, they could fall through the cracks because it's been the Pap test that gets us into the door, gets us to the doctor's office, makes the appointment to find all those other important things. And I do worry that with these changes, doctors are just not going to have access and see their patients as much, and that could be a problem.
That's alarming. Earlier this week, mammograms, now we're talking about this. You know, a lot of women are feeling that their health is under attack in some ways. Is there a coincidence about these two guidelines being released this week?
This is a coincidence, but I think it's bad timing because it does seem to send a message to women that we don't care, and I think women are losing trust in the profession. They have to hear today that the guidelines around the Pap test are helpful, will protect young women, and are smart, medically sound tests for older women. But they still need to know they need to get that regular checkup, be seen, be heard.
Is this a sign of what's to come?
I will say that I think cost does matter in healthcare, and we are increasingly going to see experts look at the things that we do, look at costs, and make sure those costs are worth.
There's a lot of debate and a lot of discussion about that.
Yes.
Dr. Marie Savard, thank you so much, and have a good weekend. Thanks, Marie.